Nursing informatics, as defined by American Nurses Association, is specialty that integrates nursing science, computer science, and information science to manage and communicate data, information, and knowledge in nursing practice. And as we go along, we will be able to discover about facts, healthcare system, and nursing informatics of European countries such as Germany, United Kingdom, and France. Germany is a cosmopolitan country shaped by pluralism of lifestyle. A cosmopolitan place or society is full of people from many different countries and cultures. Some people who is cosmopolitan has had a lot of contact with people and things from many different countries, and as a result is very open to different ideas and ways of doing things. Pluralism is political philosophy holding that people of different beliefs, backgrounds, and lifestyle can coexist in the same society and participate equally in political process. Germany is largest economy in the European Union and the fourth largest in the world after the USA, China, and Japan. The German economy has its great innovativeness and strong focus on exports to thank for its competitiveness and global networking. In high-selling sectors such as car making, mechanical and plant engineering, the chemicals industry, and medical technology, exports account for well over half of total sales in 2018, and only China and the USA exported more goods. Germany's most important trading partners are the European Union countries, and USA are artificial intelligence, blocking cyber security, smart system, e-commerce, and present a major challenge. At the same time, they offer opportunities for productive and growing startup scene in Germany. For the demographic in Germany, both sexes is 81.9 years life expectancy at birth sex combined and 84.1 years life expectancy at birth females. And for males, we have 79.6 years. And yearly, the changes is up to 0.32% and global share of 1.8% and global rank of 17.
The history of the healthcare system in Germany started with the Prime Minister of Prussia Otto von Bismarck, who was the founder and the first Chancellor of the German Empire in year 1870 to 1890. Chancellor Otto von Bismarck's Health Insurance Act of 1883 established the first social health insurance system in the world. At the beginning, health insurance coverage was only limited to blue-collar workers. Then in year 1885, the 10% of the population in Germany was insured and entitled to cash benefits in case of illness, 50% of wages for a maximum of 13 weeks, death or childbirth. While initially limited, insurance coverage gradually expanded. The final step toward the universal health coverage occurred in 2007 when health insurance, either statutory or private, was mandated for all citizens and permanent residents. Today's system in Germany provides coverage for its entire population along with a generous benefit package. The German healthcare system is notable for the sharing of decision-making powers among the federal and state governments and self-regulated organizations of payers and providers. And the image here shows that the organization of their healthcare system. So within Germany's legal framework, the federal government has wide-ranging regulatory power over healthcare but is not directly involved in care delivery. The Federal Joint Committee, which is supervised by the Federal Ministry of Health, determines the services to be covered by sickness funds. To the extent possible, coverage decisions are based on evidence from comparative effectiveness reviews and health technology assessments, in which consist of 13 voting members, 5 representatives from Association of Sickness Funds, 5 from Association of Providers, and 3 unaffiliated members. Lastly is the 5 patient representatives have an advisory role but could not vote and still have the right to participate in other decision-making bodies, including subcommittees of the Federal Joint Committees. In 2017, according to the German Health Profile 2019, Germany is the highest level among its member states, spending 4,300 per capita on healthcare, greater than a European Union average of 2,884 euro. Germany also has some of the highest rates of beds, doctors, and nurses per population in the European Union. As indicated here, the share of spending has continuously increased since the year of 2000. And to summarize the Germany's health system in terms of effectiveness, accessibility, and its resilience based on their findings, it is moderately effective but more expensive than most other European countries, effective in avoiding mortality from treatable causes, and provides essential human and infrastructural resources, which shows as second to the highest health expenditure in share of gross domestic product in the European Union, next to the France. And very few people reports of unmet medical needs for any financial reasons, all due to the health of universal health coverage, the broad social health insurance benefit basket, accessing to good services, and then contributing to low share of out-of-pocket payments due to social health insurance system, which results to their strong financial protection. However, future financial sustainability may become challenging as the population ages. Health insurance in Germany is compulsory and provides almost universal coverage, and characterized by two, which is the statutory or public health insurance, SHI in short, and the private health insurance or PHI. In addition to that, regardless of their length of stay, employed persons outside of the European Union are subjected to compulsory German health insurance, provided that they have a residence permit in addition to the work permit. Third country nationals can apply for this at the German embassy abroad or at the foreigners registration office in Germany. And the multi-payer SHI system is currently covers 87% of the Germany's population, and about 11% of the population is covered under one of the 41 private health insurance companies. However, the division into statutory and private health insurance remains one of the largest challenges for the German healthcare system as it leads to inequalities. So here's the group of people that could be insured in SHI or PHI. First, we have the SHI, which it in German. This includes employees, pensioner, and recipient of unemployment benefit. SHI in particular has offered opportunities for health protection individually and inexpensively. The right health insurance company have special additional services that can be agreed separately, such as optional tariffs or premium refunds. Insured person can also achieve financial advantages with bonus programs. These offers are anchored in the statutory health insurance services. While the membership in PA translating in German and is not possible for everyone and people that are often privately insured, which is the employee or people whose income is above or a fixed threshold or who belong to a certain professional group, such as self-employed or civil servants. It is offered by more than 40 private insurance companies and offers a number of advantages such as shorter waiting times, performance guarantee, individual tariff structure, contribution independent of income.
Healthcare IT in Germany. Unlike most other EU members, Germany has chosen to start by tackling security issue head on. And from the outset, its approach to e-health is based on the most proven foundational technology as far as privacy and security are concerned. The Germany e-health network will be enabled by personal smart cards called Elektronische Gesundheitskarte, issued by the compulsory sickness funds will provide both physician and pharmacists with access to patient data. Medical professionals, too, will have used smart cards, separate health professional cards, to access e-prescriptions and other patient data. We have here the three-stage rocket. The first one as open technologies show the way. The first stage of the launch dates back to 2007 One of the key enabling development concerned the connectors through which data will be transferred. In May intercomponent where AG and network equiper Cisco XOR provisional licensing from Gematik, the cross-sectoral German National Health IT organization, for their co-developed health card connector Cisco Healthcare Router, which was designed to Gematik specifications and for the first time allowed modern SICCT or Secure Interoperable Chip Card Terminals. For the Stage 2 Agreement on Semantic Standards and Interference, the second stage of German EHealth project launch took place at the end of 2007 to early 2008 when 30-plus health IT companies, including heavyweights such as AGFA, IBM, ICW, Microsoft, Siemens, and T-Systems, reached agreement ahead of schedule on common semantic standards as well as new open standardized interface for electronic patient record. Lastly, we have the stage 3, politics again. Technically, all that is now required to make German e-health as reality is politics. The first issue is growing resistance from traditionally conservative medical profession, mainly with regard to fear about privacy and regulatory loads about all in terms of digital signature requirements for e-prescription, and yearly conclave of German physicians has rejected the electronic health card by 101 to 78 votes.
The Medical Informatics Initiative was launched and funded by the German Federal Ministry of Education and Research, or the BMBF, to close the gap between research and healthcare. So the roadmap sets out the key goal to be achieved within the year of 2017 and 2025. Its aim is to make patient data from routine care usable for medical research. The research results obtained in this way are intended to help identify disease better, treat them, and prevent them as effectively as possible, and also intended to help patients benefit more quickly from reliable research results. So in this ongoing project, there are currently 4 medical universities that is being funded by the BMBF for its development. As for how the medical informatics initiative works, the data from a consented patient will be used for medical research purposes. The identity used is by a combination characters and encoded to protect their data from being linked back them as an individual. Once their data and consent for research has expired for 5 years, they may renew their consent for the scientists to use their data repeatedly for new insights. The patient involved may also view the activity and researches conducted on a website. The data from treatment are collected from across Germany and combined for research purposes, enabling scientists to recognize and see the cause of disease, suitable treatments, and for research and development activities, which is subjected to European data privacy legislation. This project of the Germany can be used to research in order to be able to cure disease faster and better in the future.
The second part of this presentation is about the nursing informatics in United Kingdom, to be presented by me, Divine Sesbrenia and Jerome Arceo. Let's start by getting to know the United Kingdom. United Kingdom of Great Britain and Northern Ireland is known as UK, Britain, or England. The capital is London. It has an area of 242,900 kilometers square. The United Kingdom's total population as of 2020 is over 68,886,011. The United Kingdom's government system is constitutional monarchy, which is led by the Queen Elizabeth II and Prime Minister Boris Johnson. The gross domestic product per capita as of 2019 is about $48,698. Now let's talk about the UK's demographic. First is the life expectancy. As what is shown on the graph, the life expectancy of UK from 1950 up to the year 2020 is about 70 to 80 years. And within those years, females live longer or has a higher life expectancy than males. In the year 2020, both sexes' life expectancy in UK is 81.8 years, while for females alone is 83.3 years, and males is 80.2 years. According to Global Health Observatory or WHO, women generally live longer than males, on average by 6 to 8 years. They said that this difference is partly due to an inherent biological advantage for the female, but it also reflects behavioral differences between men and women. Second is the infant mortality rate and deaths of children under 5 years old. From the year 1955 to 2020, the infant mortality rate is from less than 30 per 1,000 live births to less than 10 per 1,000 live births, while the deaths under age 5 is more than 30 per live births to less than 10 per live births. As of 2020, the infant mortality rate is about 3.3 deaths per 1,000 live births, and the deaths under age 5 is 4.3 per 1,000 live births. Third is the fertility in UK. The table shows that the year 1965 has the highest total fertility rate, which has more than 2.75 from 1955 to 2020, and the following years it drops to less than 2. The year 2020 has a 1.8 live births per woman.
Let's look back to the history of healthcare system in the United Kingdom. Okay, so before the war, the UK healthcare system is only available for the wealthy. But in 1911, David Lloyd George, the Prime Minister at that time of United Kingdom, introduced the National Insurance Act, an act that taxes employees from their wages in return for a free healthcare. However, this type of healthcare is limited towards the employees only. Moving on to 1945, after World War II, a public healthcare system was created where services were provided free at the point of need and services were financed from central taxation, making everyone eligible for care. Then, in the National Health Service or NHS, a publicly funded system responsible for the public healthcare sector of the United Kingdom, was established in 1946. The NHS is a tripartite system that was formed by splitting the services into three parts. The hospital services, in charge in taking care of the hospitals, primary care, which are the general practitioners that includes treatment for the minor injuries and ailments, and community services, which monitors the health of the community. In 1970, a reorganization effort was made which allowed local authorities to support all three areas of care. So in this tripartite system, there was an issue wherein the system grew apart. There was a wide rift between each systems, and the whole healthcare system of UK was not centralized. But by 1990, the National Health Service and Community Care Act was passed by Margaret Thatcher, the UK Prime Minister at that time, which set up independent trusts that manage hospital care. This united the tripartite system. And by the 21st century, changes in the NHS aims to dissolve the current government management to encourage the ongoing privatization of the healthcare industry. This will allow for further advancement without the government having to interfere with the healthcare, providing more services and options for the people. So this is the diagram, organization chart of the healthcare system in England. So the centralized power is the Parliament, which handles the Secretary of State and the Department of Health. Now, there is the NHS England directly under the Secretary of the State, which is controlled and advised and held accountable by the Department of Health. These two parts, the Health Watch England and Public Health England, are newer parts as introduced by the current changes of NHS England. These three parts, the Health Watch England, Public Health England, and NHS England, holds the majority of the healthcare system of the United Kingdom. So how does the UK healthcare system work? The UK healthcare is completely socialized, meaning that there is a state-funded system called National Health Services, which guarantees care for all. All treatments and appointments are free at the point of use, but it is paid for through the taxation on income of the working body. So this is how the NHS is funded. 80% of the NHS budget is funded by general taxation, mainly from income tax. And tax rates are as follows. £0 to £12,500 of wage is not tax. But when it comes to £12,500 to £50,000, there is a 20% taxation, and 50,000 to 150,000 is 40%, and more than £150,000 is 45%. So this is where NHS gets its budget. What does the NHS cover? Consultations with your doctor and general practitioner, the regular checkups, treatment and accident and emergency, treatment by specialists and consultants, sexual health services, and maternity services. However, the NHS doesn't cover dental care, eye tests, physiotherapy, tests and scans, chiropractic services, and prescription medicines. Now, this does not mean that the NHS doesn't provide those. It is more so that you have to wait in line in order to afford these services for free. There is another option later which we will discuss. So this is the other option, private health insurance in UK. As you can see in this picture, majority of United Kingdom affords healthcare insurances. Scotland with 12%, Northeastern England 14%, Northwest 15%, West Midlands 14%, Wales 15%, and so on. So, private health insurance in UK covers what the NHS doesn't cover, so you don't have to wait in line. This is the shortcomings of the current healthcare system in the United Kingdom. The government's active role in healthcare weakens the functionality of market mechanisms. This means that newer products in the market, healthcare products such as newer machines, newer technology, are often bottlenecked in the government. Tight control undertaken regarding medical expenses has resulted in a lack of medical resources such as equipment, doctors, and nurses in public hospitals. So as you can see, the NHS is centralized within the government, but it is slowly changing. This led to the lack of medical resources because government doctors are often underpaid in England. Pre-medical services provide to allow public to make extensive and excessive use of these medical services. When something is free, people often afford it even if they don't really need it. This is what's happening in the UK healthcare system.
This part explains the nursing informatics in United Kingdom. Nursing informatics in UK plays an important role in supplementing the current weakness of the healthcare system and NHS by providing support applications. So basically, NHS develop an applications. This NHS app is a simple and secure way to access a range of NHS services on your smartphone or tablet. Thus, It is very useful, relevant, and timely now because people in UK can book GP appointments, order repeat prescriptions, and access a range of other healthcare services without leaving their homes. Next, here are some of the NHS application that is based and used in UK. ACR. The ACR Digital Urinalysis app enables you to test the concentrations of albumin, a protein in the blood, and creatinine, a waste product, in a sample of your pee. ACR is a way of checking if the kidneys are working properly and is often used to monitor a number of medical conditions including diabetes. To do the test, you'll need the testing kit that's been designed to use with the app. You'll also need to pre-register. Your healthcare provider can send you a unique link which you can use. Next, Baby and Child First Aid. The British Red Cross Baby and Child First Aid app provides simple, easy-to-learn skills to help a baby or child in a first aid emergency. How does it work? The app features useful tips, animations, and video clips, helping you learn what to do in a wide range of first aid situations, from choking to broken bones. You can test your knowledge using the app's built-in first aid quizzes. And there's also a handy device to record your child's medication needs and any allergies. Next is Blue Eyes. Blue Eyes is an evidence-based app to help young people manage their emotions and reduce urges to self-harm. It includes a mood diary, a toolbox of evidence-based techniques to reduce distress, and automatic routing to emergency numbers if urges to harm continue. Next is Brush DJ. It plays 2 minutes of your music so you brush your teeth for the right amount of time. The app has short videos on how to brush your teeth and how to clean in between them using an interdental brush or floss. How does it work? Brush DJ is a fun and educational tool to help people improve their oral hygiene. The app uses music from your mobile device and plays it for 2 minutes, the recommended brushing time. You get a buzz every 30 seconds to remind you to change sides and round of applause when you finish. Next is corona-help.uk. It is a website-based, anonymous chatbot. It asks you questions about your experience with coronavirus, including if you have any symptoms, if you are staying at home, and if you are currently self-isolating.
So for the last country, I will discuss to you nursing informatics in France. So before we proceed, I will give you a brief information about France and why France ranked as the best national healthcare system in the world by the World Health Organization. Getting to know France. France is a country in Western Europe that is officially known as the French Republic, French France, or République Française. Their nationality is French, the capital city is Paris, the type of government in France is Republic, and their constitution is the Constitution of October 4, 1958. France has the total population of 67.4 million people in 2021, and their language is French. So, did you know that the term informatics was introduced in the 1960s in France, and their version is informatique? And of course, it makes sense to use the informatics since the whole field of healthcare and medical informatics is based on data and information. French hospital system, or hôpital, or more commonly Santé Hospitalier. French hospitals can be found in the main French cities and bigger towns by following signs saying CHR, meaning the regional hospitals, CHS
Specialist hospitals, or CHU, is a university hospitals. Hospitals in France can be public, private non-profit, or private for-profit. Public hospitals account for a third of the 2,890 hospitals. They are legally autonomous and manage their own budget, and there are four levels of public hospitals. First is local hospitals, which is hospitals that providing health and social care at community level. Most of their doctors are self-employed private practitioners. Next is the general hospitals, which is hospital that provide a range of acute care services such as medicine, surgery, and obstetrics, rehabilitation, long-term care, and in some cases of psychiatric care. Next is the regional hospitals and specialized hospitals. There are 32 regional hospitals, which is a higher level of specialization and technical capacity that are in charge of more complex cases. Next is the private non-profit hospitals are owned by religious organizations, foundations, or mutual insurance associations. Last is the private for-profit hospitals account for 40% of all hospitals in France, but 20% of all inpatient beds. They tend to specialize in certain areas, such as elective surgery, where they cover two-thirds of the activity. In 2016, Lee Point ranked the University Hospital of Bordeaux as the best hospital in France. And in a survey published by Forbes, the American Hospital of Paris was ranked not only as one of the best hospitals in Paris and France, but also in the whole world. Now let's proceed to the background of healthcare in France. The public health insurance program in France was established in 1945. This program aims to require all the residents in France to have a health insurance, and it is based on a principle of solidarity, guaranteeing financial protection against life contingencies for everyone. France has the highest quality healthcare system that offers universal coverage for all citizens, regardless of age or economic situation. It consists of an integrated network of public and private services, including doctors, hospitals, and specialist providers, which makes the French healthcare system highly accessible even for foreigners. In 1997, the World Health Organization ranked France's healthcare system first in the world. And also, according to the World Health Organization, they also found that France delivered the closest to best overall healthcare in the world, and its evaluation of World Health Care System in 2000. And France is ranked 11th on the 2018 Euro Health Consumer Index and had been praised for its efficacy and outcomes. Next is the Ministry of Social Affairs and Health. It administrates public health care in France with primary or secondary care services delivered by the various different healthcare providers. France offers a high level of preventive healthcare with available services including addiction prevention, regular medical checkups, and the promotion of physical activity and healthy eating. The ANES, or the National Agency for Health Accreditation and Evaluation in English, is a government agency wherein they are in charge of providing recommendations and procedure guidelines. There are clinical practice guidelines relating to the diagnosis, care, and monitoring of some disorders, as well as the assessment of payment arrangements in certain education. The French system allows citizens more choice when it comes to treatment because they don't have the issue of insurance companies restricting things like which doctors a patient can seek treatment from, so that the government founded the national security that allows everyone in France to access affordable healthcare whether you are citizen, resident, or tourist. Next is the life expectancy of France. The average life expectancy in France is 83.18, and it is expected to increase in upcoming next 50 years. Life expectancy is above average when compared to global average, which is currently Hong Kong ranks first for life expectancy of 85 years. France ranks 10 in items of average life expectancy around the world. And the focus on preventive care in France means that after being treated, patients are less likely to need to return for follow-up care, meaning which also France spend less on healthcare, about half what the US does. France average fertility rate. In France, women give birth to 1.97 children every year, and this fertility rate is expected to be decreased. Healthcare cost in France. The healthcare system in France is funded partially by the obligatory French Social Security contribution, or the Social Security. These are usually deducted from the salary. In 2016, employees paid around 8% of salary, while employers paid around 13%. Healthcare in France is also partially funded by the government, and the patient also pays a small contribution to their healthcare cost. France state health insurance covers between 70 to 100% of cost for things such as doctor visits and hospital costs. Low income and long term sick patients receive 100% coverage. Since then, doctors and certain medical personnel are not allowed to charge upfront payments. Instead, they receive payment directly from the government or health insurance. Health insurance in France. Public healthcare in France is accessible by all residents through French health insurance contributions. As in many European countries, healthcare in France is an insurance-based system. It is compulsory for French residents to register for health insurance. As of 2016, a new healthcare system for foreigners known as Protection Universelle Maladie, or PUMA, allows access to state healthcare after 3 months of residence. Those earning below a certain threshold can apply for complementary coverage called CMUC, or the Complementary Solidarity Health, as of 1st November 2019. It is a help to pay the health expenses if the resources are modest. Depending on the resources, it costs nothing or costs less than €1 per day and per person. The right to Solidarity Health supplement depends on the situation and resources. Those not eligible for state health insurance, or those who want a higher level of insurance coverage, need to take out private health insurance from a local or expat health insurance company such as Cigna Global, Assureland, and Allianz Care. Temporary visitors to France from the European Union, European Economic Area, or Switzerland can access public healthcare if they have a European health insurance card. This card is a vital for European citizens and residents traveling within any member country of the European Union. With the use of this card, people can take to any public doctor or hospital in the European Union member country and receive healthcare for free or reduced cost. Next is the Informatics in France. The French Association for the Applications of Medical Informatics, or AIM, was created in 1968. It is a scholarly society mainly composed of researchers and university teachers. It is approximately 500 members are working for a better integration of information in the healthcare system to improve quality of care and patient management. AIM's goals are the following. First is to promote computer applications, scientific researchers, and their corresponding technical developments within the healthcare system. Second is to introduce these computer applications to healthcare professionals, interested administrations, and concerned industrial actors. Third is to simplify exchanges between healthcare professionals such as physicians, biologists, administrators, nurses, researchers, and scientists specialized in computer science as well as research organization and concert association representative or agency. Fourth is to contribute to healthcare professionals, researchers, and engineers' education to medical informatics. Fifth, it is to collaborate with groups and scientific associations sharing synergetic goals. And lastly, is to participate to the professional thinking that should precede or give rise to the update of official texts that regulate the atomic automatic processing of medical data. Next is the current informatics practice in France. DMP, or the Dossier Medical Partage, is the France National Electronic Patient Medical Record that stores centralized and secure patient health information. It is a public project launched in France by the Ministry of Health aimed at ensuring that every Frenchman has a computerized patient record containing all the patient's medical data. The project is launched by the Health Insurance Act of August 13, 2004. As you can see in the figure, the DMP is a patient-specific electronic medical record system designed to keep track of the key elements of patients' clinical pathways in order to allow for better coordination of the healthcare professionals involved in the management of their care. After each interaction with the healthcare system, health professionals must input the following key elements into the DMP, such as hospital reports, lab results, x-ray results, drugs prescribed, primary care summaries, and other general information that the physician thinks will be useful for the patient's care coordination. And the patient can also copy or upload data into a specific part of the DMP. So how to create this DMP? So that the healthcare provider or the doctor needs to compatible software or to connect to the dossier via the internet. So patient access it only by the internet. The dossier belongs to the patient and they control the healthcare provider's access to it. Any patient with the vital card and the national social security number can create a dossier. A doctor or healthcare provider has to be registered with the smart card and know the patient SS number. Patient secure access depends on their SS number and password via the protected site. All data are stored in France. The purpose of the DMP was to provide treating physician with the most complete information so that he could propose the most appropriate treatment for or examination and also avoid redundancy of examination or prescriptions. is tele-expertise and telemonitoring. So in France, their telemedicine is called the H4D, which is an expert in clinical telemedicine based in Paris region that developed a special telemedicine booth which is capable in taking blood pressure, temperature, blood oxygen levels, breathing, heartbeat, and even carrying out the electrogram. It facilitates the access in a healthcare by allowing patient to consult a doctor remotely in the consult station, which is considered the first connected local telemedicine booth. This medical device allows quality.
So that's all for the presentation of Group 1 about the nursing informatics in Europe countries. Thank you for listening.